And now I'm going to screen share. And y'all should be able to see where we left off yesterday, talking about allergies, right? Everybody see that? Yeah, because that's the prep video.
Oh.
Are y'all able to see the PowerPoint? Somebody's got to mute their mic before we get started. All right, so let's get started. Allergies. Allergies, you know, we're got this thrown in here with immunity because a lot of people, we think when we think of an allergy, we just think of it as something, okay, well, you know, pollen, dust, you know, cat fur, something like that. But allergies have a lot more components to them than what we realize. And when we start thinking about allergies, it's not just like, you know, oh, I have a sinus allergy, or oh, I'm allergic to that. It's deeper than that, because allergies, when we start, that goes into the immune system, and as far as the reaction that occurs when our body senses something foreign. And that action is what kind of cascades and triggers everything as far as our immune system to get started. So there's allergies, but then there's also a little, they have a very complex side to them. All right, but right now let's focus on the, you know, one everybody's kind of familiar with. You know, there could be substances like pollen, dust, mold. A lot of people nowadays have food allergies, like to peanuts, and gluten allergies, and other, you know, foods that if they eat, that could cause severe reactions. And we've talked about that a mild allergic reaction, right? That's one that maybe just causes irritation at the site if you were stung, or it might cause a little bit of a rash. Now, what was it when you had a severe reaction? A severe reaction is when you have actual anaphylaxis and your body goes into a state of shock because the substance that you were, or that you were either bitten by or ingested or exposed to is completely taxing your entire body. And so your body kind of goes into a state of red alert. And unfortunately, one of the side effects is swelling. And because we've talked about, you know, how that when our body's crying out for help, you know, or telling you that it's repairing, or telling you that it's fixing something, like, you know, a busted ankle, what does it do? It gets red and swollen and painful. Well, this is an internal kind of response. And we begin to see the same thing with anaphylaxis, but on a grand scale. So not only do we have maybe external signs that something's wrong, like hives and whelps and swelling, but we have internal signs. There's a whole storm of happening inside of the body, and one of the major uh, complications of anaphylaxis is internal swelling, mainly the airway. right? Because if that swells up, that closes, somebody's not going to get the proper oxygen that they need for their body to be able to function and live and continue. That's why anaphylaxis is an emergency. It's something that has to be, treated right away. Now, we know that sometimes, you've heard of people being allergic to bees or certain medications. Like for me, I'm anaphylactically allergic to sulfa drugs, but penicillin gives me a mild allergic reaction, like a rash. So there are differences, and it's showing you the common things that might give somebody that mild reaction: the sneezing, the runny eyes, maybe a little swelling in the sinuses. And then we kind of just deal with that living in the area where we are. And when I was in Texas, it was the same way, because the pollen, and then when the trees start, Brian, get that cat. Sorry, my cat's doing his cat thing again. The pollen and everything is so bad, and then now that I move here to Florida, I see that as well. It's it's crazy, the amount of pollen that covers the little dust on the cars and stuff, so like that. And most of us, it's an irritating thing, but some people, it can really cause moderate discomfort as far as sinus infections and the pain and the headaches and that kind of thing. But there's a definite difference between allergies and anaphylaxis. This is what I want you to write down, okay? I want you to make sure you write this word down. Make sure that you fully understand what anaphylaxis is, okay? And I know that we've talked about it before, and I know that we can be pretty rest assured that y'all understand it, and the extent of it, because like I said, I know we talked about it before. But common things are bee stings, peanuts, shellfish like shrimp and stuff. And what do we do for anaphylaxis? The most common thing is the EpiPen. And some people know, hey, I am deathly allergic to bees. So their doctor will say, let's go ahead and keep a prescription of this EpiPen on your file, and you carry one if you're going to be anywhere that you might come in contact with bees. So this might be that serious. I know that I've given the example that when my son was in elementary school, the school nurse and I were talking about allergies and stuff like that, and how we just noticed that over the years that it's gotten bad. So many, because you go back to when I was in third grade many years ago, you didn't have like a allergy table like they have set up at schools now, for a peanut free table or something like that. This is wasn't there. These allergies are developing, and who knows why. There's all kinds of theories. But she opened up her cabinets in the nurse's office, and it was just lined with students' EpiPens. And I was just like, wow. And she's like, yeah. She said, this is how, and it's not like a doctor's just going to write this and hand it over. No, that means that person had to have had some kind of reaction that was severe enough for them to write a prescription for an EpiPen. So whatever it is, like I said, there's some people think it's our diets, environment, toxins, whatever, that are causing, this increase in allergies that cause the body to be so severe that it brings about anaphylaxis. So, but there's definitely an increase from what there used to be, especially with food allergies. This poor woman here, she's got some serious anaphylaxis going. Her eyes are swollen shut. Her cheeks, and this is not a bad Botox gone wrong. This is anaphylaxis. So you can see everything swelling. Now, why I use this picture is if you can see that external swelling, what do you think's happening to her internally? It's as equal. The swelling is the same. And that's why anaphylaxis is such an emergency. Because think about that airway and think about how narrow it is to begin with. And that's why it's an emergency to treat somebody that you suspect of anaphylaxis quickly. And we're going to go back here to these signs. And I can tell you, because I've had 3 anaphylactic reactions, they were all due to sulfa. First time was a sulfa drug. I think I was 18, and it was bad, but it wasn't bad. It was hives, and it looked like I had been, whipped, and I had a little lip swelling. And my mom took me to the emergency room, and they're like, "Oh well, she's on sulfa right now. Well, no more of that." So the second time was I was at a gas station. I don't know what I came in contact with, but it was in an area called Pasadena, Texas. There's a lot of refineries, and the gas station itself was one of them ones that had a whole bunch of the different eco brand gasolines. And the only thing that we can think is there was either sulfur, leak in the area or something, but it was bad. And I had pumped the gas and then went into the Walmart. And by the time I was walking around, started just itching, and I realized the signs of it. And I looked down and started seeing the little whelp marks. So I went over to got my phone, went over to the pharmacy aisle, started opening Benadryl capsules and putting them underneath my tongue. And I called 911, and I told an employee there, I have an anaphylactic reaction. Well, I was sitting by the front door because I knew that's where the paramedics would come in at. And sure enough, what was it? It was 3 of my paramedic. Well, one wasn't, but the 2 that showed up, because there was 3 on the unit, had been my paramedic students. And they're like, and I was like, yeah. And they looked at me and then looked away. Well, what is it? I said, I have a sulfur. And I told them I did sub-Q Benadryl, and they automatically gave me, sublingual Benadryl, and they'd automatically given me Epi. But by the time they ended up getting me on the ambulance, I could feel my airway closing. And they were pushing different drugs and starting IVs and stuff to stop. And then the last time it happened was because a doctor gave me a prescription for medication, and the medication is not even really in the sulfur family, but it's made like a minute amount of it is made on a base of sulfur, and it's called Microbid. And that time was bad. We were on our way, me and the kids and my husband, to a SeaWorld in Texas, and I just started itching, and he looked over, and he was just like, and he found there was, I guess, a fire station right there, and he pulled in. By the time they were about this close to having to intubate me because my airway was that bad. So like I said, having these, I can tell you the first thing for me, it might be different for everyone, but what do I always tell you? Your skin's going to try to warn you. And that's where one of the very first things I always noticed is I started itching. And then I started having like little patches and hives, right? And then I started feeling tingly and numb around my my mouth and that area. I started having a anxiety, just like it says on here. I noticed that I was having a little bit more difficulty bringing air in, and my heart rate increased. I had nausea. So I had a lot of these signs that you see here. Now, for everyone, it might be different. There's no telling. And there's some people, they're exposed to, say like peanuts, and they might go from sitting there talking to you to accidentally being exposed to peanuts and be completely in anaphylactic shock with a closed airway within a matter of minutes. So the severity depends from person to person to person. The symptoms depend from person to person. Your job as an MA is to recognize that. That's why when we give a patient an injection, we don't just say, hey, here's your shot, have a nice day. We say, hey, this is the medication and the doctor wants me to give it to you, and this is how we're going to give it to you, and I'm going to have you sit around and we're going to check in on you we're going to keep you here about 15 minutes or so. All right, make sure that you're not going to have any type of reaction to it. And one of my pet peeves is when you give a patient a medication they've never had before, and you don't just close the door and walk away. You leave the door open. You're back and forth. Yeah, you might have other patients, but you are checking on them every few minutes during that 15 minutes. Some doctors will say keep them there 15 minutes. Some doctors will say 25, 30. Some doctors will say give it to them and make them sit in the waiting room, right? Because there's other people, and if something goes wrong, then somebody will go, hey, But every doctor does things a little bit different. But these are the things that you, as an MA, need to watch out for. Is if you give somebody an injection and you walk back over there and they're just digging at their skin or just start looking like they had a bad Botox, these would be signs to alert the doctor quickly. And we talked about Epi. We talked about her anaphylaxis. And I'm going to post this video. And it basically talks to you and it gives you a detailed understanding of what's happening inside the body. And you know what I was talking about, that cascade of chemicals that's happening. So, the allergen comes in and the body's like, what is this? And then it starts the histamine reaction and so forth. And this video here, I like it because it does explain it in detail, but if you hang in there, it's not too advanced. It's not too hard to understand. The next thing we're going to talk about is chronic lymphedema. And that's when we think of edema, what is that? That's swelling, right? Well, chronic means what? Long term. And lymph is because it's coming from the lymph areas. And it's usually, we see this when patients have very slow drainage, because I told you the lymph system, the lymphatic system, is like a highway of flowing, moving, just like our cardiovascular system is flowing and moving. So is the lymphatic. But sometimes the lymphatic system can get blocked up and start moving slower. And when this happens, it can cause lymphedema. And sometimes it's one side, like one arm or one leg, or a specific lymph node. Other times it's an entire region, all right? And what's ends up happening is there is a because of the blockage, there's a backup of the lymph fluid, and it's not able to drain properly, and it leads to swelling. And this is an example of lymphedema. And you can see the drastic difference, but somewhere probably around the groin, there's a lymph node blockage. And so she's got that buildup of all that excess fluid causing the extreme swelling. And like I said, this is mainly due to the lymph not being able to drain. We usually see this in our extremities, the arms and the legs, okay? Now, there are two types of lymphedema. There can be primary, right? This means that it just occurs on its own. The lymph nodes get blocked on their own. But most common is what we call secondary lymphedema, and it is caused by a disease or a condition. And sometimes that could be from cancer treatments, sometimes that's caused from obesity, sometimes that's caused from immune system disorders, or I'm trying to think, sometimes I've even seen it with diabetics, stuff like that. So when a patient experiences lymphedema, this is not like something that just comes and it resolves on its own. It's usually a long-going thing. That's where it comes, the chronic. You can imagine that limb or whatever is going to feel heavy. It's going to feel tight. It's going to feel like the skin is stretched and being pulled. It's going to be painful, and it's also going to cause for a decreased healing time. Because if you have all that swelling and all that extra fluid there, it's going to slow down circulation as well. And then over time, if it's not resolved, these patients' skin in this area will become really thick and feel almost like an animal hide or like a skin. The best way I can say is, if you've ever, our skin feels a certain way, but if you've ever felt like a elephant skin, or like a rhino, you know how they would fit, it almost gets thick and hard like that. And that's one of the effects of the lymphedema, and it being stretched and swollen for so long. That fibrosis, that's what that's called, is it begins to set in and become a permanent condition. And also sometimes that may be the reason when you see people like this, the skin looks real dark and crusty and dry looking around that area, and that's that fibrosis. Now, there is a difference between lymphedema, right? This is because the lymph nodes blocked somewhere. And then lipedema, all right? This lipo, we know as fat. So this is where a more serious issue. This is basically excessive fat pockets. And we can see this usually in obese people, but you see this sometimes in skinny women and men as well. And it's just where they have, like, instead of the fat being a smooth distributed, smooth appearance, it kind of lumps, and it gives that lumpy look to the skin. All right. It's more cosmetic, but usually like I said, we see this in obese people, and we know that obesity is a hazard and it's a danger to one's health. As far as treatment for lymphedema, there are actually centers and entire places where people who do have lymphedema can go for treatment, because there are processes that they can do. One of the more common ones is where they wrap and they bind and they massage that area, trying to open and trying to increase the flow and help open back up the passages that are blocked. Exercise, working like physical therapy, is sometimes a good idea. Having a person who's extremely overweight start losing weight. You know, these are all things that they can do as far as helping somebody with lymphedema. There's no cure, but the main part is just working on controlling how swollen it gets, trying to restore that flow, and preventing it from happening again if they do get control over it. Okay. All right, we're going to move on. We're going to talk about cancer. And cancer, when we start thinking about that, a lot of people have a misconception. They think of cancer as something that you just get. It was very scary to me when I realized that most cancers are in you, and our immune system controls them. Cancer just means that when a cell, could be any cell, could be on the pancreas, it could be on the breast, it could be on the uterus. Well, we know cells divide and cells continue and tissue grows. But with what happens with cancer is then cells begin to divide and they forget to stop. And it's an overgrowth of cells. And our body, because a lot of times it's our own cell, doesn't automatically sense something's wrong. Okay, and when that happens, that can actually become something that is harmful to us. Now, there are two types of abnormal cell growth. Sometimes it happens and it's just a bunch of clump of cells and it's not anything to really worry about. We call that benign, okay? But other times, when we do worry and when the those cells begin to gather up and they are taking a bad effect on the body, we call those malignant. And what do we know back from medical terminology? Mal meaning bad, right? So malignant. And one of the issues with cancer, if cancer was just something that, you know, oh, okay, grows right here and it's going to stay right there, and we can just go in there and cut it out or do radiation or something like that, that would be pretty successful. That's why I was talking with breast cancer. You find a small lump. That's why we do monthly breast checks. You find a small lump, you go in every year for your mammogram after 40, and you catch that cell growth at its first stage. And you have a 97 to 99% chance that you're going to completely survive and never have another issue with it. All right? But if you're not doing them breast checks and you're not going in for the mammograms, you're not staying on top of it, what usually ends up happening is those abnormal cell growths, they continue to grow and they begin to spread. And when they spread, this is a term for it. It's called metastasize. And this is when it becomes bad. This is when it becomes a harder battle to treat. a harder battle to overcome. And we always want to avoid it metastasizing to other organs, other places, and that can happen. My my kid's grandfather, my ex-father-in-law from my husband who passed, he's 78, and he got a lung cancer from working in chemical factories and stuff, and it is now metastasized. He didn't even realize he had lung cancer. But when they found it, it was because his back hurt, and it had metastasized into a spinal cord, and now it's moved, and it's bad because he never went to the doctor. He never had checked on it and those kind of things. He did that typical man thing. I'm okay, and that's usually when we get the really bad results. Got another friend of mine right now. He's like a dad to me. His name's Jay. He taught me my paramedic, and I feel like he made me the teacher that I am. And he's right now he's got stage 2 colorectal cancer, and it's stage 2 because, believe it or not, he was having difficulty, saw a little blood in his stool, but he didn't want to go and have anything put in his booty. And because of his fear of having anything in his butt, now he's got stage 2, when they could have caught it way earlier if he had been going in and having those colorectal screenings. So that's why I told you it's very important, especially when you reach certain ages. They recommend, hey, guys, get a prostate exam. Ladies, if you're sexually active, pap smears. Women, certain age you need mammograms. These rules are there, and to give you that opportunity to be able to catch that thing. One of the great things is our immune system in a healthy person will usually, say 90% of the time, we might have a cell that begins to divide or look funny. And our immune system's running around and it's catching that, controlling it before it even has a chance to do anything crazy. So that's why our immune system plays such a major, massive part in keeping us healthy and keeping our body. Even our body sometimes can go wrong, and our immune system's there to keep it in check. Now, cancers of the blood like leukemia, they don't form a mass of cells. They're slightly different. Instead of it being an abnormal cell growth, what happens with leukemia, because that's cancers of the blood, is that the blood cells become abnormal. Sometimes they become shaped wrong, or sometimes they get too few or too many. There's many different kinds of leukemias, and when that happens, that still is able to be treated, but it's treated sometimes a little differently than how we would treat like a regular, like say cancer of the breast or cancer of the rectum. We never want, like I said, when you go in, some people will go in because, say, they have a mole, and their PCP says, hey, go get that mole checked out by a dermatologist. So the dermatologist goes in and says, oh yeah, that's malignant. That's bad. Let's go ahead and get that taken off. And so they do the extraction of that. But then other times, they come in and it goes, oh no, that's just a normal, tumor, or like a little fatty mass, and it's benign. Benign means non-cancerous. So I'd like to make sure you please write these words down. Malignant is bad and it's cancerous, and benign means that even though it appears to be you know, a tumor or something like that, it's not cancerous. All right. Now, a lot of times what I will tell you is that doctors, when they do find benign tumors, they'll go ahead and remove them just to make sure nothing, the body doesn't, you know, they don't decide to become shady or grow anything abnormal, right? Because even benign brain tumors can be life-threatening, because in that area, it's so highly vascular, that's so compact. If we have a little tumor that's growing, what is it going to be doing? It's taking up space. And that space is vital, because that space could very well be pushing and squeezing on blood vessels and occluding blood supply to certain areas of the brain. And I'm going to stop here. I'm going to post this video, okay? This is about the biology of cancer. And it's going to go over and it's going to talk about this. This is a term you'd write down. It's called oncogenes, all right? And it's going to explain this really well. It's going to be one of your online lab for today. And we talk about, and it's going to talk to you about how it's a gene that in certain circumstances can transform a cell into a tumor cell. Okay, so but I'm going to leave that here. Does anybody have any questions? Nope, everybody's quiet. Not a peep in the room.
No, ma'am.
All right. Well, it's Friday. I want, if you haven't got your SurveyMonkey turned in, please do so right away. And I'm gonna, like I said, I got a couple of things I'm gonna be posting in Teams for y'all. And besides that, please have a wonderful weekend. And like always, I'll post everything for next week, sometimes this weekend, okay? Have a good weekend, guys.
Thank you, you too.
Oh, did y'all also see I put the lab sign up? So there's a, I think there's a day and a night one you have choices for. So if you're doing on campus at the school labs, that's where you sign up, okay? All right,
Awesome
bye guys.
sauce. Bye-bye.
Make sure you hang up.